certainly total knee replacement has some significant risk to it. This is a major operation, and as such, you can have major complications. Many patients will ask what those risks are. Certainly the big risks, the risks that are most feared by guys like me, are going to be infection and blood clots, because those tend to have the most severe outcomes when they're encountered. The other one that I worry about with knees especially is stiffness and persistent pain. So let's talk about each of those briefly and what they mean and what we can do to prevent them. The first let's talk about is infection. Infection is about a 1% risk or so, a little bit higher in patients who have diabetes or have other reasons that their immune system wouldn't be quite as strong. So in the preparation for total knee replacement, we do a variety of testing to see if patients are colonized with more aggressive types of bacteria. We give antibiotics around the time of the surgery. We wear special operating attire that covers our entire head and face in its entirety as well. So there's, in addition to the usual precautions we take to prevent infection, there are some extra steps that we take prior to total joint replacement. In the unfortunate chance that an infection does present, especially if the infection goes on to be a chronic infection or is deep in the tissues, the outcomes can be pretty severe. In those cases, the implants have to be removed, and the patient has to go a period of antibiotic treatment before the implants can be replaced. That's pretty rare. Most often, if there is an infection, the infections tend to be above the level of the muscles and tend to be fairly treatable. Next, let's talk about blood clots. The inflammation around the knee at the time of surgery can increase the likelihood of blood clots. There's been a great deal of attention given to this problem and how to prevent it, but also how to treat it. So, in basic terms, we know that if we thin the blood, that helps to prevent it. We know that if the patient will be more active, that also helps to circulate that blood and helps to prevent blood clots. We also know that blood clots can run in families, and we try to ensure that before we undergo the surgery, that we've asked about blood clots in the family and whether anyone in the family, meaning mom, dad, brothers, sisters, and even maybe uncles or aunts or grandparents, have ever had a blood clot, especially a fatal blood clot. Those questions are very important because it may help us decide to be a little bit more aggressive in how we try to prevent that with some blood thinners. The downside to blood thinners, of course, is that blood thinners can cause bleeding complications. Both in the surgery wound, it can create a lot of bleeding that then, of course, prevents motion and increases pain, but it can also cause bleeding in other areas, such as the stomach or the brain, and those can have devastating complications as well. So you can see the difficulty with trying to treat this. The treatment itself presents some risk. To not treat also presents risk. So blood clots are something that we have to watch very closely. About 1 in 1,000 or so patients can have a fatal blood clot after a total knee or total hip replacement. The risk of getting a blood clot does not necessarily mean that you would die from it or even have any complications from it. In fact, it happens that small clots evolve very frequently, but they never become significant or meaningful to the patient, which further makes it difficult to know which ones are meaningful, which ones should we treat, and how aggressive to be with it. So just because a patient may have had a small clot doesn't necessarily mean that their life was threatened or that there is a bad outcome that is certain to follow. But it certainly makes us anxious as the surgeons. Finally, let's talk about stiffness. This is a much more common complication. About 80 to 90% of total joint replacements have great outcomes, depending on which studies you look at. In my opinion, when we look at those patients and we look at that 10 to 20% of patients that aren't as happy as they wish they were about their knee replacement. The number one factor that stands out in my experience has been knee stiffness. What you do after surgery, and I'll talk a little bit more about this later, the patient's role in therapy and aggressive activity is critically important in the outcome of this operation. And stiffness frequently presents in patients who had difficulty accomplishing their physical therapy, typically due to pain. And so that is a risk. Oftentimes patients who think they're not going to have any problem with this tend to have a struggle with getting through their therapy. And so we take that pretty seriously. We have a whole program of therapy designed to help prevent stiffness after a total knee replacement. But suffice to say that a stiff knee doesn't feel good. It doesn't feel natural, and it doesn't move well. And so stiff joints, in my experience, never feel good. They never feel normal, and they almost always are accompanied with pain.